Hello, my name is Lisa Rudd, and I'm a student in Nursing 597. And today I wanted to present what I'm going to cover for my topic for my learning activity that is part of my Practicum Part 2. I'm going to look at what's called a nonlinear PowerPoint as a novel technique to actually to teach physical assessment for the pre-licensure nurse. And this is going to be an accelerated BSN program through South University. And so basically, the idea is that physical assessment skills are very key, regardless of the area of nursing that you work in. And it's very important to be able to assess if there's a change in patient condition. Very important thing that is very hard to teach and requires a lot of skill, as well as really learning how methods to teach this. So basically, the description of my innovation is that I'm going to come up with something called nonlinear PowerPoint. And what that is that it is sort of a PowerPoint where you have hidden screens that, depending on the learner, what they select, what they choose, with their learning activity, they can have different content can be presented. So this is really neat because it's customizable so that the student can decide where they're weak at and what they want to learn. And it's also prevents you from repeating content that the student is very confident in. So that's really unique. And so that's pretty much what I've decided for my project. I'm mostly going to work on cardiovascular and lung sounds as the area that I want to teach. And this is going to be combined with an in-class activity where I will attend lab and supplement the teaching portion of it and also reinforce some of the skills that have been presented in that PowerPoint. Also, I'm going to do a pre and post test of knowledge so that I could gauge what the students know before and after the activity, and also come up with a basically some quizzes that basically the student can see what they know and what they've mastered, as well as a way that they can evaluate me as an instructor. So I think that's very important with that. And I also plan on doing something called using the guiding theory called cognitivism, which is important in instruction, especially for an online content that is something that is a new topic where the student is just learning some of the basic skills, which is very important because basically with something that's very fundamental, it's really important that they get the foundations. It's harder to use other guiding theories that require more advanced skills when you are learning the very basics of things. So that is really what I want to focus on and with my talk. And so basically, I want to use a pre and post test, and I want to assess whether they've learned the material. And we'll have many quizzes and so forth. And then in the actual skills practicum, where I'm on site, that'll be that one-on-one time to see how well they've mastered that material. Also, I would like to see there's something called Student Effectiveness of Teaching, or SET, that I plan to implement that will give me as an instructor an idea of how well I'm doing. So I really think, even though PowerPoint is sort of an old school idea, I think that's a very good idea in terms of being able to really have a new spin on something that is well known. And so part of the National League of Nursing core competencies that I'm going to strive to achieve is to facilitate learning through providing a variety of educational materials to demonstrate proper technique of physical assessment. And again, part of that is going to be really doing a lot of research and refinement of a lot of the tools and techniques that I've already established in the first part of my Practicum. And also looking at, of course, you get a very, very basic PowerPoint, but really getting one that's going to be effective and at the appropriate level for the students is an interesting thing to that's going to take some work. Also, I started working on some case studies last semester, and I'm going to continue working on that this semester to really illustrate the points that I want to show, and those are going to require a lot of critical thinking skills, and that goes to the National League of Nursing core competency, facilitating learner development and socialization, because that's something that either in an in-class setting they can discuss, or on possibly a group peer discussion on a discussion board can discuss. And so again, that's something that I would like to look at. And of course, with my pre and post quizzes, those are going to be my NLN core competency of using assessment and evaluation strategies. And so from there, and I will see how well that worked. And I also hope there's enough time that I can actually get feedback from my students and see what they liked or didn't like about my materials. And if either that's going to be food for thought for hopefully my first position as a nurse educator, or to further refine things this semester. So I think that's very important, being open to your students and making sure that they are able to approach you with what works and what doesn't. Okay, and so mostly that's going to be it for what I'm planning. And so again, we can also have little mini teaching supplement activities. I'm planning to do that possibly after as the very last thing of my practicum, where I go over what worked, where it didn't, and I'm not going to have time to develop a whole new curriculum, but I might, let's say that the quiz was not very effective. I might come up with, okay, let me redeploy another quiz and see how well it works this time, and maybe right before Thanksgiving break, have a little WebEx meeting where I can talk with the students and say, hey, did this work better for you? So having that open dialogue is very important. So I'll use all these experiences. Also, I plan to use that UDL best practice for design, with coming up with PowerPoints that are interactive, that have the right amount of material, that aren't an excessive amount of material, but that so that it's hard to view so much content, but have an appropriate amount of material as well as appropriate amount of graphics, so that it's interactive and engaging. And those are the best practice design principles. And hopefully I will learn some very useful techniques that will be helpful going forward. And I think that this is a great project because even now as a nurse, I'm learning that the basic fundamental physical assessment is so key to diagnosing a patient's changing condition. And even though it's very fundamental, you keep coming back to it. And I keep coming back to it as, a nurse with about 3 to 4 years experience of something that you could easily miss, something very significant just with a physical exam. So it's very important not just to focus on just passing medications or following the doctor's orders, but being able to tell if there's a difference in patient condition. So that's something that will be very important for any nurse in any sphere that they work in. So I'm hoping that, and also that, I developed this looking at some of the evidence-based tools, looking at some feedback from, I guess, graduating classes that have said that physical assessment skills are a weak area for new nurses. So with this and looking at that evidence-based criteria and feedback from statistics, I see that that's an area that is going to need attention, and it would be very interesting to see in upcoming years if implementing this type of project will improve scores for students. So I'm very interested in seeing how this works, and hopefully material that I present and develop this semester will be used for this current class and upcoming semesters. So thank you so much to listening to my talk, and I look forward to hearing from everyone and hearing what great ideas everyone has this semester. Okay, and I'm getting close to my time, so do thank you for your attention, and we'll see you in the discussion boards coming up. All right, thank you. Have a great day.